Hi everyone, it's great to be here with you. We're here with our lovely patient who's volunteered to allow us to basically video her Emface treatment. I just wanted to spend a couple of minutes and just express to you what this treatment does. I'm super excited about what Emface does. It's going to be a revolutionary treatment in addressing one of the major signs of aging, which is muscle sagging. For the first time, we can actually deliver energy deep into the muscles. These are selective muscles called the elevators, which unfortunately lose their tone as we age and lead to jowling. In the example of the forehead, that's an elevator muscle called the frontalis, and as basically it loses its tone, basically the eyebrows drop. And then we're using our eyebrows to really lift up to see better, and that leads to wrinkles. So now we can actually address these muscles and increase their tone, and hence cause lifting of the skin without any surgery, without any needles. It's a series of 4 20-minute sessions. We do them about every week or two. It's not painful at all. There's no recovery. And basically there are these pads that are being applied to the cheeks over the elevator muscles as well as the forehead, which is the frontalis. And you're just going to get this basically delivery of 2 forms of energy. One is HIFES, which stands for high intensity focused electrical stimulation, which penetrates these muscles and causes them to have a workout. So it's just you're basically getting contractions of these muscles. And over time, these muscles increase their tone and can actually support the skin better and lift. In the case of the forehead, you can actually get a little brow lift without any surgery. The second component of the treatment is what we call radiofrequency, which is delivering energy into the dermis, which is the collagen layer, and stimulating collagen elastin. So as a result, our skin actually thickens, and therefore the wrinkles get better. So the forehead wrinkles can get better, the wrinkles on the face can get better. There are published studies that actually show that the face actually increases in volume. In the case of our lovely patient, I told her she's gonna see some forehead wrinkles get better. She's gonna see a little bit of brow elevation. She's going to see some of these lines on her cheek actually improve. She'll hopefully see her jowls get better, and she's going to see her volume of her face get better. So with that said, we'll go ahead and get started. So here you can actually see that the pads are applied. So basically the pads are applied to strategically over what we call the elevator muscles, which are the zygomatic major, minor, as well as the rhizorius. Those are muscles that are elevators. You can actually see the contractions causes this involuntary movement of her cheeks. How does it feel to you?
It just feels like it's pulling my face up.
Okay. So it's interesting. It's a little weird sensation, but I assume it's not painful, right?
No.
Okay, good. Then the third pad is going across her forehead. It's basically delivering HIFES, which is again that muscle stimulation deep into the frontalis, and you can actually see her eyebrows involuntarily move up. We have actually controlled the percentage of energy that's being delivered. So she's at 100%. So we start out somewhat conservatively, and depending on how the patient tolerates it, we'll bump it up to the maximum level. So here you can see that the HIFES, the muscle stimulation, is at 100. Then there's also the radiofrequency, and that's what's really delivering what we call monopolar radiofrequency deep into the soft tissue, and then that's what's stimulating collagen, elastin, and that's what's going to help really with fine lines and skin tone, texture. So we're back, and she's completed her treatment. I was explaining to her that, with one treatment, we're not going to see a dramatic change. If we do see some minor improvement, that's wonderful. Her skin definitely looks more plump. That could be just from the heat of the machine, and that's kind of creating some temporary swelling, which leads to some improvement. But I'll let her be the judge of that. How do you feel?
I feel fine. It doesn't hurt. I don't feel sore.
Great, great, wonderful. But truly, even with one treatment, I would say, I would argue maybe her jowls are a little bit better, her skin is a little bit more plump, even her forehead lines are a little bit better. But again, I know that she's going to need a series of 4 sessions, so we'll see her once a week over the next month, and then we'll show you her results after, and then the results just continue to get better over 3 months.